to introduce the Aging with Pride session this morning with Maria, Robert and Barbara from Birmingham LGBT on behalf of Aging Better in Birmingham. And I'm Vicky O'Donoghue. For anyone that doesn't know me, I'm the project lead for the co-production project and the main organiser for this festival on behalf of all the Aging Better partners across the network. So I just wanted to go through a little bit of housekeeping with you before I hand over to Maria. We're actually on webinar platform this morning, which is slightly different to the usual meetings platform. So that means that we can't see you, although we can see who's in the room. But we can still interact with you through the Q&A, and there will be opportunities to ask questions to the panel throughout the webinar. So you will see that there's a Q&A chat box available to you. So please do use that to post any questions that come up for you as we go through the presentation and session this morning. But you can also use the general chat box to chat amongst yourselves and introduce yourselves to each other as well. So please do feel free to use that function as well for sort of general comments. We will be playing a few videos for you this morning. We've done a bit of a sound check this morning and they're coming through a little bit sketchy. They're okay, but Maria's going to share the links with you as well. So if you do have any sort of issues seeing and listening to those, then you can of course play those afterwards, but we think they'll be okay. The quality will be okay for the presentation. They're just not as flowing as we'd like them to be. So without further ado, I'm going to hand you over to Maria, who will signpost the session for you, and I'll be doing the slides. So over to you, Maria.
Thank you, Vicky. Hi everyone, my name's Maria Hughes. I work for Birmingham LGBT as part of the Aging Better in Birmingham programme. As it's a webinar, we do want to make it a bit more interactive, so we thought we'd ask you some multiple choice questions. So we'll do this in the form of a Zoom poll. So I'm now going to ask Vicky if she wouldn't mind putting up poll question 1. And this is about when the first UK Gay Pride March took place, which was in London. Okay, this takes a little bit of swapping over. So please just take a moment to put your answers in, and then we'll let you know which one's the right answer. Okay. Excellent. So we have neck and neck between 1972 and 1974. The correct answer is 1972. This is when the first official UK Gay Pride rally was held in London. Thank you. If we go back to the slides, please. Marvellous. And next slide, please. Thank you. I wanted to give you a little bit of the background to Aging Better in Birmingham before we talk about the specific campaign. We are one of the 14 programmes across England that was set up by the Big Lottery, and hopefully you will know by now that the purpose of Aging Better is to combat isolation and loneliness amongst people aged 50 and over. And in Birmingham we did this by supporting active citizens to set up and develop community-based groups and activities. And you will see some of those citizens in some of the videos that follow. Birmingham is a super diverse city. We've got a very diverse mixture of people from different faiths, different ethnicities, sexual orientation, gender identity, age, levels of disability, and it's a huge local authority. It's the biggest one in Europe. So you can see we had quite a big task on our hands running a programme across Birmingham. So we decided to do this by having some targeted support, as well as a city-wide hub which covered anyone who wanted to get involved in the programme. We did have 4 priority hubs. 2 that were in particular parts of Birmingham, the Sparkbrook and Tyburn wards, and they were picked up because of specific needs people had in those wards. And 2 particular groups of interest, which were carers and the LGBT community. So this is why there were 5 hubs. We all worked together as a big team, but each of the hubs has got its own specific plans, and we take care of specific groups of people. Okay, thank you. Next slide, please. Tell you a bit about the LGBT hub, which is what we are responsible for. We're based at Birmingham LGBT, which is an award-winning health and wellbeing charity. And amongst the other services we provide, Aging Better provides opportunities for isolated older LGBT people to participate in activities and to encourage them to take a more active role. My role is called the Network Enabler for the LGBT community. Now, as well as working with individual citizens and groups, one of the other things we were asked to do was to look into combating the long-term reasons for isolation and loneliness. And we did this through what's called a local action plan. We held focus groups, we ran surveys, we talked to a lot of people that we work with and alongside, and the results were independently analysed. And one of the things that came out of that piece of research was the need for a public campaign which we called Ageing with Pride. Next slide, please. Okay, this is the first of the videos. This is to introduce why we wanted to work in this way. Thank you.
Favourite thing about the Birmingham LGBT community is the wide diversity and inclusion, because everyone's from different backgrounds, different places, then whoever you are, you're going to be welcomed in.
The next part of the campaign was all about bridging the gap, and that's what Generations is part of. So we're part of trying to get older and younger generations of LGBT people together to talk about the issues that divide them, and to actually start conversations which will then be targeted at places that can continue the conversations and actually make tangible change to Birmingham's LGBT community.
These people paved the way for us to live freely and be who we are today. So I feel like if I see an older person out, I'll speak to them and be like, hey, how's your day been? Like, what's been going on? I just feel that the younger community shouldn't be so judgmental of the elder community because, like I said, they are the originals.
Thanks, Vicky. Next slide, please. Here's our next multiple choice question. So obviously we need to nip out of our presentation and back into poll mode. When was the age of consent for bisexual and homosexual men equalised without heterosexual men, age 16? When did that take place? Thank you. And here it is. Right, okay. So the most popular answer is 2001. Yes, we've got some very learned people in the audience, I think. Next slide, please. It was set by at 21 following the Wolfenden report, which recommended decriminalisation in 1967. It was only lowered to 18 in 1995 and finally to 16 in 2001. And as I was researching all of these dates to get them correct, I discovered that the age of consent for women, regardless of sexual orientation, was set at 16 in 1885. So you know, you can see that there's already quite a lot of discrimination between the sexes in this manner. Right, thank you. Next slide, please. So what was the campaign all about? Well, it was, as all of the work we do in Ageing Better, it was to celebrate older people's lives, and in particular the lives of older LGBT people, and to present positive images and increase the visibility. We wanted to promote positive messages about all the members of the LGBT community from all backgrounds, and raise awareness both within and without the community of the causes of social isolation. And to try and combat these by highlighting positive human interest stories. We wanted to tackle something that came up time and time again in the research we did, which was addressing ageism in the LGBT community. It sometimes astonishes people that where there's a community that's being discriminated against, that it feels like everyone should be in it together, but unfortunately there is discrimination within the community as well. And ageism was an important issue. Naturally, we wanted to challenge homophobia and all stereotypes that can cause social isolation in older age. And of course, with working in a co-productive way, we want to engage volunteers and active citizens. Next slide, please. So what did we do? A team of volunteers was recruited from across Birmingham to act as ambassadors, and you're going to be meeting 2 of those in this webinar. They took part in photo and video shoots and brought their own unique stories and experiences to the campaign. We did a lot of advertising. Obviously, it's a public campaign. We needed to get the message out there. So, as well as using social media channels, we tried to get things out in the public domain. We saw adverts on buses, on billboards, digital screens in various places, and some of our ambassadors went on visits to care homes, for instance, and came to public events, and we had a load of posters and leaflets produced, which we were able to send out to get the message out there. And the message was built around the 3 key messages, really. Keep your rainbow. Getting older shouldn't mean fading away. Keep your rainbow and age with pride. Bridge the gap. Over 50 isn't over the hill. Find out why by bridging the gap between youth and experience. And continue the journey. They fought for our equality. Don't let them drift into the background. Celebrate our over 50s and continue what they started. And one of the most important aspects of the Ageing in Birmingham campaign and work was to bring people of different generations together, which is what we hope to do in the video you've already seen. Next slide, please. So this is just some examples of some of the things we put out there in the media. So obviously you can see that we're advertising in what you might call the pink press. There's an online magazine called Queer 40, which we had an interview in, and Gay Times, but also Birmingham Mail, our local paper, did a piece on us as well. So it was as important to reach people outside the LGBT community as it was inside. Next slide, please. Aha, another question for you, another multiple choice question. So Vicky, if you want to start up the poll, please. One of the things that came out through our research quite a lot was people being concerned about accessing mainstream services such as health. So this next question is from a survey done by Stonewall. So what percentage of LGBT people aren't out to any healthcare professional about their sexual orientation when seeking general medical care? Let's give you a moment to put in your answers. Okay, and the majority have come out as 25%. Vicky, if you can set the slides up again, please. She's working very hard in the background there. The answer is actually not as high as you thought, but it is quite high, 19%. So in effect, 1 in 5 people don't come out to healthcare professionals. And I know some people might think, well, you know, what is the need to know? Why do healthcare professionals need to know? It's extremely important that people can feel that they can talk about their whole lives, their relationships with other people within a healthcare setting. The last thing people want to do if they're being seen by a doctor or if they're in hospital is to feel that they have to worry about who's going to be visiting them and how other staff and patients are going to react to that, for instance. Okay, so we'll have our next video set up if you don't mind, please. Next slide. And we'll see how that runs.
I came from a community where drag queens was accepted.
I came out in 1978 after quite a long time of not quite being sure who I was.
I had those feelings in me, but there was nothing in, you didn't have anything in the papers. We had the socialist worker at home and it didn't really sort of cover it.
I would call myself an activist ever since.
As a result, if there was anyone in the family that was gay, that is also accepted.
I grew up in rural Cornwall, so it was a lesson for me to kind of find out who I was and especially how far the LGBT community's come.
People don't feel they have to fit into stereotypes so much.
There's access to support, there's access to people that are like you. We have an ageing population whose needs are very different. Those voices need to be heard.
People before us have been fighting so that we can enjoy the benefits.
We don't take anything for granted. We've seen changes where things that we've fought for have gone backward. Things will move on, but you have to be part of that change.
Okay, so I've done quite a lot of talking, and actually the important thing about this campaign is the people who are involved in it, sort of at the coalface. So I'd like to introduce one of the people you've just seen in the video, Robert, if you wouldn't mind telling us a bit about your experiences, please.
Sure thing, Marie. Yeah, I'm Robert. I'm a gay man. I'm out at work. And I was involved in the local network at work, and then when I retired at 65, I decided I got involved with aging better, and as part of that came along this opportunity with Aging with Pride. The first sort of real connection with that was I got involved in the evaluation of it, you know, even before it sort of started. So not only was the program Aging with Pride, but it was important to evaluate whether it actually made any changes. So I was involved in the pre and post program. It was done by an external group who were doing that, and we were advising on the questions that have been asked. We're also giving access to groups where they might be able to distribute the questionnaires, etc., for that sort of thing. So that was quite an important role of understanding what the whole aim of Aging with Pride was. As you can see, I became a participant. I'm not shy. Flash my face around, as they say, in videos and leaflets and bus shelter things. It was always entertaining. Somebody else spotted it and said, "Is that you?" Yes. So I'm not I think as I've got older, I'm less of a shrinking violet, as they say. I also walk with the group. We're in Birmingham. We have a Pride, or we used to. We haven't for the last 2 years, but we walk with Pride for Aging with Pride as part of that large group. It's a very big festival in Birmingham. as many prides are nowadays. Very colourful and very exciting, but very intergenerational as well. So it was quite it was quite a mixed group of people involved in that Aging with Pride. As Marie mentioned, a part of that thing was one of the quite interesting things. I visited the 3 hospices that we have in Birmingham. Not something I sort of normally sort of think about as probably myself in terms of LGBT, but we were going in there to sort of help them to become what we might call gay friendly, and that in terms of the atmosphere that's there, and that may be just a bit about where you've got images on the walls and things. You know, you might have, why not have a same-sex couple as well as family couples and all that sort of things, because there are a lively sort of sharing place, and of course a lot of people dropping in the daytime because it has quite a mixed community there. It's not all end of life sort of work there, and also sort of the odd rainbow or whatever. But the really great thing was that we were very made welcome. The door was already open, so that was quite positive that these organisations were already thinking about how to engage, so that somebody, if they were coming end of life, they wouldn't sort of feel then, well, if my boyfriend or my husband comes in and kisses me, that somebody's going to make comment. You know, would I, in my end of life, will I feel uncomfortable about how people approach me? And I think that was quite an important thing. It was interesting that you know, they, plus some of the other ones in the Midlands hospices, and they were involved in Pride as well. So it was good that they were a community looking to actually engage. The other part I got involved in the interview for a worker to design LGBT awareness training for care homes. And again, we get into that age. I've got a stepmother in a care home, and you know, maybe that's my future. One hopes not just yet, but again, one wants to be able to feel comfortable sort of having the pictures, you know, of men as my thing, and all that assumption, you know, whether you had, you know, in terms of your previous life, people just assuming that you had a female partner or something or whatever, that it can be seen as sort of fairly normal thing. And also sometimes being sensitive to those different things, because there are married couples and they're taking it for, say, the male, his wife dies and he then decides to have a male partner at the end of life, but doesn't tell the rest of the family, and having to do with those sorts of issues in a care home. I think, you know, that sensitivity and understanding of how these things are still in society. It's got a bit mixed. It got a bit frustrated by COVID, but it's still working on it in terms of that looking for that delivery partner to do that. And I feel that's one of the very important contributions that this Aging with Pride has done, is looking at that sort of broader spectrum of society. It's not just purely about us as LGBT feeling great at age. We want to share that and say, and I think it may be that part of that, you know, it's just I want other people to understand how I'm going. Thank you, Marie.
Thank you, Robert. That's given us it's a lot to think about, and I think that, as Robert says, although COVID put a bit of a stymie on the work we were doing, you know, all of the people that we've worked with are very keen to sort of get up and running with this campaign aims again as soon as we possibly can. Right, it's time for another question. So, Vicky, if you wouldn't mind working your magic in the background, please. This question is asking about the percentage of transgender people who've experienced a hate crime or incident because of their gender identity over the previous 12-month period. And again, this is from some research by Stonewall. So you'll see the poll any minute now and ask you to vote for the answer you think is correct. Right, okay, if we can go back to the slides, please. Yes, unfortunately, this time around, the correct answer is 41%. It is the highest, and, you know, this is obviously one of the things that we are very concerned about, and we want to ensure that people who experience any hate crime, whether it's related to their gender identity or sexual orientation, is supported. Next slide, please. And if you can play the video, thank you.
There is more work to be done, of course. Not all communities are accepting.
It's taken like 28 years, maybe more, for us to say, you know what, there are other people who identify as LGBT, but they happen to be of a different race or a different ethnicity or culture.
I think the only way to get rid of that is to have interaction and to have it truly happen on a face-to-face basis, because without conversation, then things get imagined, divisions get exaggerated.
I find my nephews, they'll ask me questions, very straightforward, shocking questions, and then go off on a tangent about some toy. Whereas 20 years ago, I wouldn't know what to say to them. Now you can discuss it quite openly.
Education in schools also is really important, because homophobic bullying is still definitely a thing and needs to be tackled as well.
Always going to get these individual hassles that pop up where people refuse to, in actual fact, not change but accept that diversity is here to stay.
The point of view I want is basically that a trans person will be just looked like as any other person, that they'll get the healthcare they need, they'll get the gender affirming procedures they need.
I've been involved with some asylum seekers and refugees. It's still in many countries it's illegal.
Imprisonment, that can mean flogging, that can mean a death sentence just for being who you are and loving who you want.
Women are across the world often are treated as chattel, and you know, all sorts of horrible things happen to them.
I'd like to see a lot more work trying to influence other countries to be more understanding about their lesbian and gay and trans citizens.
But what I love about it is when they come to the LGBT centre, they're able to be who they are with pride.
The more we can celebrate our history, remember our roots, and allow that to inform how we develop and evolve, the better for everyone.
You heard a little bit from Barbara, our other guest speaker today, so I'm going to hand the microphone, as it were, over to Barbara to tell us about her experiences.
Thank you, Maria. I'm 68. I've been retired since I was 60. I was quite lucky. But back in the day with me, the thing that you did to leave home respectfully, you got married. And I married a man, obviously. And there's a lot of lesbians that I know of my age that did marry. But I came to the conclusion that it wasn't right for me when I was about 25, 26. And I came out straight away, basically because I feel that you've got to be proud of what you are, who you are. If you're not proud, then you need to change how you do sort of things. And I was in the civil service, and when I came out to my boss, he put me on his back of his motorbike, drove me out to Tamworth, and said to me, "Give me a couple of pints of beer." And he said to me, "You're too good looking to be one of them lezzies. because that was the thing back in the day. It was, you know, if you were a lesbian because you were too ugly to get a bloke. But things have changed a lot since then, and I think that, you know, that the thing that I've took with me all my life is to make sure that you inform people, keep them in. You know, I'm out and proud. Keep them informed about yourself, and then get them to learn sort of different things. I used to take a lot of my straight girl colleagues to the gay clubs because I used to love dancing with the gay blokes because they smelt nice and they dressed better and they didn't come on to them, sort of stuff. So I think the Aging with Pride initiative is brilliant, really, because there's a lot of people that are not as fortunate as me to be out and proud in their community, and it's this helps people, gives them the confidence, if you like, to come out in their community. And it's more difficult, I think, in certain groups, you know, sort of if you do different religions, or some religions are a lot more harsher about homosexuality than others. I've been to a couple of care homes and stuff and talked to the staff there. They've had staff meetings, and there are care homes are now getting a lot more, as Robert said, a lot more accepting and understanding, and you do see quite a lot of rainbow flags around, which I think is, you know, is a great way of actually showing that they're accepting of different sexualities. I think just what else. The thing is that I mean, my gaydar is not very good anyway. I never make assumptions about people. But the thing is, if you're out and proud and working amongst your community, which I do, then that's the best way to do it. And I've got to say, I'm accepted and valued by my local community, as well as, you know, through the people that I meet through the gay scene in Birmingham. But yeah, and as Robert says, the gay scene is a lot more old age friendly now than it was, but it needs to move a bit further. So from there, but you know, you got to keep the job going. Hope that's okay. Yeah.
Thank you so much, Barbara. And obviously, people are going to have the opportunity through the Q&A box to come back to both of you, and if they got any specific questions about what you've experienced. And as you see, you know, I think one of the aims of this campaign was to combat the ageism within the LGBT community, and as Barbara said, that seems to be starting to have some traction, which is brilliant. Right, so what did happen next in the campaign? Next slide, please, Vicky. Thank you. So there was continuous evaluation all the way through the campaign, and a final report was created. And it was to see if it had been effective in raising awareness of ageing and its issues, and if it helped increase understanding and respect for older LG people within the LGBT community and outside of it, of course. One of the participants of the evaluation said that LGBT people today do not have to remain hidden to the extent that they used to, and can be part of their wider community, which has to be welcomed. Nothing is perfect, of course, but the journey is being made in the right direction, which reflects what Barbara just said as well. So one of the conclusions of the report was that Ageing with Pride has clearly raised awareness as to ageing and the risk of isolation amongst the older LGBT community, and gone some way to changing attitudes, with significant increases in awareness about the risk of social isolation for LGBT people in later life. And our Ageing with Pride ambassadors, Robert and Barbara here today, and others that are involved as well, are still engaged with the Ageing Better in Birmingham programme as members of its Age of Experience group. This was a group of older people from across Birmingham, all the diverse communities, that was set up right at the start of the Ageing Better in Birmingham programme. They've been involved in co-production and co-design all the way through the programme, and have, as you can see, have helped not only as part of the Ageing with Pride campaign, but also helped with the monitoring and evaluation of it to make sure it was effective. Right, I have one more poll question for you. So, Vicky, if you don't mind setting that up, please. So, as part of a national programme, the Ageing Better programme has to report to a national evaluator, ECORIS. And so this question, the answer to this question comes from their research. So what percentage of LGBT participants in the Ageing Better in Birmingham programme said their loneliness and isolation had improved due to participation? And by improved, I meant they got less lonely and isolated. Okay, let's see how we do this. People are very optimistic and not going for the lower numbers as yet. Okay. Yes, you're absolutely correct. It is 41%, the majority of you said that. Thank you. If we can go back to the slides, please. So we've come to the end of our presentation, and so it's over to you, our audience, if you want to put any questions in the Q&A box. There aren't any questions at the moment. I can ask Barbara and Robert some questions if you prefer. I think they're primed and ready. Okay, so is there anything that either of you would like to add to what you've said, and you know, about your focusing on your experiences as ambassadors, as people who are sort of taking forward this campaign?
I think it's, yes, being an ambassador or whatever it is. I mean, I've being a gay man is part of me. It's not the only thing that's there, but I'm happy to discuss those sort of the gay politics or whatever it is with people I meet in social activities or whatever it is, and to be involved in things that maybe that are going to impact on me, and contributing sometimes simply as a citizen of Birmingham, but also a citizen that happens to come from a gay background, which may have an impact on, say, health services or whatever it is. So I think, or transport or whatever it is. Not everything is LGBT. You know, whether they close a road, what's the gay thing? But I mean, I do feel that it's important that as well as a community that we actually participate in the more social world as well, so that we can do things like you know, give our expressions of our thoughts and feelings, which helps those who are in the you know, making those decisions in terms of spending our hard-earned taxes.
Yeah, I think what I've enjoyed about it, really, I mean, I've enjoyed a lot of things about it, but it stopped me getting isolated, and it's great to meet people from all over Brum, from different backgrounds, different heritage, and actually talk to people about sexuality, because as I say, I've you know, been out and proud since I was 25, and get them to understand more. And if they get to know you first as an individual, and they like you as an individual, then accepting your sexuality, I think, is fine. You know, there's not a problem, is there? So, that's why I've enjoyed my experiences. But,
yeah, thank you. And I know, Barbara, that aside from this campaign, you've also been involved in the Ageing Better LGBT housing group.
Yes,
and that you've also gone to speak to staff at a housing association as well. How did that go?
It went very well, actually, but yeah, you could tell that they were looking at themselves and going, never thought of that, you know. So you can see people sort of thinking, that's a bit of information, that's something I didn't know about. I think, you know, the more you talk to somebody about your experience and other people's experiences, the more they learn about the diversity and, you know, where people come from, what issues they have, all sorts of things. You don't make assumptions. You ask the questions and you listen to the answers. And I think, I'm hoping that that I've made that step forward with a few people like that. I think that sort of those sort of places are the best place to do it, you know, where they feel comfortable in where they work, but you can talk to them about things outside of their normal sort of agenda.
Actually, Claire from Opening Doors London has asked a question about the experiences in visiting care homes. Did you approach them, or did they invite you?
I think they might have invited me. I'm not sure now, because I think this was organised through Rico. So I can't remember for certain.
I mean, for one care home, because I happen to know the care home manager, so I had that discussion because it's a Care Quality Commission. One of the things that's on their sort of list is actually about whether it's a LGBT friendly place, and this is a friend who knows that I'm gay, so we had that discussion, and then I introduced them to the LGBT centre, and I think people went in there actually to do that. So I think it's both ways. But now that's been developed to fund actually a person to go and then talk directly to that community, either via, you know, also I think probably using their links within the city council, because obviously the city council has an ex procurement manager who did all that sort of thing about number of organisations, and therefore going through the council, one can also try to develop that in together with those care homes. But you probably know more about that, Marie, in terms of that programme that was then funded.
Yes, I can say that as somebody who worked alongside the campaign, although not running the campaign, I'd already made contacts with care homes and similar providers in Birmingham, again through the Ageing Better LGBT housing group as part of that, and hospices as well. So we'd already got a bit of a relationship with them, and so when the time came to think about, okay, who should we ask, where should we get ourselves invited to, we already had a bit of an idea where to run with that. And talking of the care homes, someone from Alive Activities has asked, Robert, you said about training in care homes, what would be your top tips for making care homes more inclusive? And obviously I'm going to throw that question open to both of you.
I think it's just it is that awareness sort of thing, that sort of, it's just the approach you make to people, is that sort of don't making assumptions, you know, that person, about a person's life and the pictures they're doing, and saying, is this your son or brother or something, rather than, you know, this, oh no, this is my partner. It's those sorts of things of trying to avoid making those assumptions about that, and not, and also that sort of there is the acceptance that if a partner comes in and kisses, you know, that there is how you deal with that sort of thing in a care home. I have a boyfriend, and if I want to kiss him in a restaurant, I will do. And if I end up in a care home, unless my brain's totally gone, I would probably still want to do that. And it's sort of that acceptance, and not somebody thinking, oh, it's making that atmosphere where one can feel comfortable with that. But there's also then the awareness for people who are older as well, going into that environment of being sort of honest with them, trying to help them to be honest with themselves, so that they can relax and enjoy the experience of being in, whether it's a care home or whether it's sort of a supported living type environment, that they can be honest with themselves and feel comfortable.
Do you have anything to add to that, Barbara? Your top tips for a gay-friendly care home?
I think Rob's right. I mean, there are, as you say, Marie, we've had involvement from quite a few care home companies, and they've learnt a lot. And some of them are obviously more geared up for this acceptance than others. But I think there's a move towards that acceptance and that understanding. You know, as what it says, really, you can't. It's difficult for some people, because they've never experienced gay people, maybe, or don't think they have, for them to accept as a carer that somebody could be, you know, a gay man or a lesbian. It's all to do with education, but it's actually making sure as well, I suppose, that the individual that we're talking about is confident enough to come out about that. And you know, I feel confident enough. Robert feels confident enough, but not everybody does. So it is difficult for some people. But you've got to be proud of yourself, proud of what you are, who you are. Try to be.
Absolutely. And I would add to that and make the point that nobody's asking for, if you like, special treatment. The fact is that in Birmingham, as we've said, a super diverse community, there are going to be people in care homes from a range of ethnicities, faiths. They're going to have different health needs, you know, and all we're asking is to be part of the recognition of that diversity. So, you know, making sure that anyone that should feel comfortable to say, you know, I'm a Muslim and I'm now celebrating Eid. I'm a Sikh and I'm celebrating Vaisakhi. I'm a gay person and I'm celebrating Gay Pride. It's all part of the same thing. It's part of recognising diversity across the board.
Yeah. And of course, I could be a Muslim and I'm gay.
Exactly.
And you know, a Sikh and I'm gay.
Precisely.
Yeah.
And I think, as you say, it's quite important to recognise that people might not feel safe. So it's no good waiting for them to tell you. You need to create the atmosphere that makes people feel safe to disclose, and that could be everything from the posters on the walls to the policies for people who actually go into these facilities. And I know, for instance, the Anchor Hanover Housing Association, as we know, they tell potential new residents that they're LGBT affirmative, and basically that if the person is not comfortable with that, then they're not going to be comfortable with that housing association, because that's how they're going to be. So
yeah.
I think I would say it needs to be really from the top to the bottom of the whole agency, needs to be behind supporting people from diverse communities. Marvellous. There's been a message in the chat saying thank you for today. We're a shining example to other cities, and hopefully when their granddaughter is older, the world will be a wiser place. And again, I think that's true. I think the generation now who are possibly fearful of being out and proud, as you are in the community, hopefully generations to come will look at the examples you've set, and society will change for the better, and people won't feel the need to be so fearful of others. I think that's quite a positive message. We don't seem to have any more questions, nothing in chat or Q&A. So I think we hopefully will draw it to a close there. I do encourage people who have watched the videos to click on the link, because there are more videos on the Aging with Pride channel as well you might be interested in. And if you've got any questions you want to ask me about the campaign, my email's also in there as well. Okay, Vicky, did you want to round up the end?
Thank you so much for a really inspiring and heartwarming session. Actually, it was so lovely to hear more about the campaign. And I actually went through a whole range of emotions whilst listening to that presentation and to listening to your stories and, you know, your sort of openness and honesty, sort of from sadness through to elation. And I was laughing out loud at one point with Barbara's sort of way of putting things across in terms of her experiences. That was funny. And I'm loving that Robert's sort of just, you know, around the city in bush shelters and various on various posters. Next time I come to Birmingham, I'm going to be looking out for you. That's
it used to be a very derogative thing to say, I'm on the back of the bus.
Exactly. But no, that's fantastic. And I know that this is part of a number of sessions that's coming to the festival from Aging Better in Birmingham as well. We've got another one this afternoon on co-production within a super diverse city, which of course you absolutely are and are a shining example, as Judith said. And then we have another session around working with the BAME community as well tomorrow. So still lots to come, but yes, thank you so much to all of you for such a fantastic session.